As we head towards the end of 2024, we wanted to say a great big thank you to all of our supporters who have enabled our work across the areas of health, nutrition, education, child protection, gender-based violence across Rwanda and Burundi.
This year, we achieved significant milestones in enhancing the quality of services delivered to children and their families by empowering our staff across both development and humanitarian settings. We ensured more impactful and sustainable outcomes. We also amplified our collaboration with partners and stakeholders, which has been instrumental in the successful implementation of our programs in Rwanda and in Burundi.
Our health and nutrition services provided interventions in 6 refugee camps and 3 transit centers across Rwanda. Through your support, you enabled us to treat over 270,000 curative outpatient consultations. This included over 110,000 children who were treated for various childhood illnesses. Our reproductive health services also recorded over 3,000 safe or skilled deliveries, including 311 cesarean sections that were performed in Mahama II Medicalized Health Center. Over 1,300 people living with various mental health conditions were also treated in our mental health services. Our HIV and AIDS program also tested about 10,000 refugees for HIV, with 1,050 people living with HIV in various locations supported. Our nutrition services also screened about 14,000 children below the age of 5 and 2,700 pregnant lactating women for early detection of malnutrition. This also provided treatment for over 1,100 children with severe and moderate malnutrition, out of whom 769 children were cured and discharged out of our supplementary feeding projects. In response to outbreaks in Rwanda, SCI was in the forefront in fighting Marburg and Mpox viral outbreaks. Through these interventions, we provided vital supplies and trained well over 280 staff, volunteers, and cleaners on these diseases. Also through this outbreak response, 120,000 refugees were reached with various prevention messages.
Under education, we have significantly enhanced the quality of pre-primary education. Through our collaborative efforts with the government and partners, we reached over 484,000 pre-primary children and over 49,000 adults. We distributed over 24,000 teaching and learning materials, including the Kinyarwanda teacher guides and the social-emotional learning guides, among others. This year, we aim to distribute over 128 storybooks to public pre-primary classrooms to foster a culture of reading among children. Additionally, we trained over 7,000 pre-primary teachers in improving teaching methodologies to enhance learning outcomes.
Through our Zero Out of School Children project, your invaluable support has enabled us to make a profound impact on a national scale. In just 1 year, we identified together approximately 140,000 children who were out of school, including those with disabilities, assessed their needs, and have been working diligently to ensure their enrollment in school. So far, over 42,000 are now attending school. Furthermore, we have worked with the Ministry of Education to improve on its existing digital system to track individual learners' attendance. This aims to allow the school community to swiftly address absenteeism for greater retention and academic success. We are deeply grateful to everyone contributing to this effort, helping to ensure that every child is not only enrolled but also supported to stay in school and thrive.
In child protection, we trained 900 parents on the Safe Families program to enhance their understanding and knowledge of creating a safe and happy environment at home and the community. Your support enabled us to reach over 13,000 children through child and youth-friendly space activities. Our child protection and GBV prevention and response services benefited over 24,000 children and adults. Our child rights governance program strengthened the capacity of 33 civil society organizations, including child-led organizations. We empowered 2,000 children, including 164 children with disabilities, to organize and lead advocacy and campaign activities. 3 campaigns were led by children at both national and global levels and reached over 15,000 people, including over 5,000 children.
We deeply appreciate your support and collaboration in improving the lives of refugee children and their families across Rwanda refugee camps, transit centers, urban settings, and host communities. As a child-focused organization, we are committed to sustaining this momentum and remaining at the forefront of delivering life-saving services, child protection, and gender-based violence prevention to all those in need of humanitarian assistance.
2024 was a great year for KUMEHAP. It was great because it was our 3rd year of operations and also our 1st year in our new 3-year strategic plan. And this year has been very unique. We disbursed over $500,000 in investments to early stage businesses and exciting innovations such as our first low-cost health clinic that was established in Kamonyi, Southern Province in Rwanda, run by a local nursepreneur that will serve a community of over 50,000 in Rugarika sector. We also launched a digital center in Mahama refugee camp, a solar-powered building, and 5G Starlink connected internet. This center offers multi-layer businesses. They offer a digital platform for languages, IT, and entrepreneurship. It also provides access to an internet cafe where refugees pay to access internet so that they can look for jobs or education opportunities. Collectively, this center employs over 20 staff. We also continued our expansion plans and have made our first investments in Uganda, and our expansion in other countries is underway. Those include Zimbabwe, Somalia, Mozambique, Liberia, and more. And we are also continuing to see interest in many more other countries where we will plan to engage.
Through our emergency health responses, we were able to conduct some Mpox and cholera outbreaks interventions. We were able to reach about 160,000 people throughout the awareness activities. Also, we were able to reach about 17,000 people in the construction sites where we conduct awareness on prevention of sexual exploitation and abuse in about 21 communes of Burundi. With the support, we've also been able to support about 600 women groups, including 130 men, on economic empowerment through these LA activities. Our cross-border work has been strengthened with our Tanzanian counterparts, where we are able to unify and establish family contacts with families across borders. And also, we've been able to support about 40,000 children and youth through our child-friendly activities.
These are just a few of the key achievements recorded. I would also like to add that this year has marked the end of our 3-year strategic plan, which we have been implementing since 2022. We are grateful that together with our partners and stakeholders, including children themselves, we reflected on the current situation of child rights in Burundi and also Rwanda, and refreshed our strategy 2025-2027 for every child to survive, learn, and be protected. We look forward to engaging and interacting with you in the implementation of this strategy, which will focus on health, education, child protection and child rights governance, child poverty, as well as climate change.
Thank you for making our 2024 a huge success. Our achievements wouldn't have been possible without your collaboration and financial support. We're looking forward to working with you in 2025. Our staff, the children, the families that we support, thank you and wish you a happy new year.